What's going on, guys? So it's been 3 weeks, I think, since my last video. The last one I posted, I was day 30, and now I am on day 53. So just a little over 7 weeks post this grade 3 separation on this left shoulder here. I'll talk about where I'm at now, plans going forward. In my last video, I did mention I was going to see a shoulder specialist and see what they had to say regarding this separation. I did have that visit, and I'll get to that. Let's start with how I'm doing now. So I've been back to work now for, I think, week and a half, almost 2 weeks now, going on my second week here. And shoulder's been feeling pretty good at work. I am an RN, so we do, we got to move patients around, push beds, doing all these things. And shoulder's been holding up pretty well there. In the gym, I've been testing things out, and I can do 15 push-ups pretty easily now. I got up to 60-pound dumbbells, but I will say anything past like 45, 50 pounds, the left shoulder definitely gets fatigued quite a bit quicker than the right side here. But I'm able to do 60-pound dumbbells. I think I did 8 reps on that. Prior to this injury, I was doing 80, 90, 95-pound dumbbells for anywhere from 8 to 12 reps, pretty much without issues. So to be expected though, a lot weaker, but I didn't really do any lifting for basically 5-6 weeks. I know I saw some comments in the last video about, oh man, after 10 days, how does this guy have all this range of motion and everything? I don't know, guys. I just kept it moving from day one. So I started physical therapy basically as soon as I could. Day 2, day 3, I was really trying, and hey, those first couple days, you can't do anything. And I couldn't lift my arm above about right here for at least a couple days. So I just kept really pushing it. Did I take it as slow as the physical therapist and my ortho PA wanted me? No. But I kept it moving and kept trying to get it stronger and strengthening it, and it's feeling pretty good. One of the weird things, so I think with this injury and anybody that sustained this injury, you just know the shoulder just doesn't feel right. Okay. Yes, I can do everything. Got full range of motion. Like back in the gym doing some light weights. I can do a couple pull-ups again. Up to 60-pound dumbbells. I'm happy with that. But it just doesn't feel right. I don't really have pain anymore. It's just kind of an uncomfortable feeling. Anything across the body, that's when you can see, right? That's when it really starts popping. And of course, I got the little bump here too, but it doesn't look too bad. Anyways, it just doesn't feel normal, and I just hope it starts stabilizing more over time, which it probably will. I have to remember I'm only 53 days into this injury, and a lot of people say it's 6 months to a year before you start having any kind of level of normalcy with that injured side. So anyways, that's kind of where I'm at physically. I'm playing golf again, played 18 holes, pretty much no problem. Shoulder gets a little tired, but I can play golf. I'm back in the gym. I'm pretty much back to all my normal activities, the things that I care about anyways, and was able to play basketball about a week ago, and ultimately it feels okay. Like I said, just gets a little tired, gets a little uncomfortable sometimes, but no real 10 out of 10 pain or anything like that. Like you said, full range of motion. Gosh, I can do anything with this left arm, right? No problem. It'll get better. This one, the only thing that's a little uncomfortable is coming up and in like that. I can feel that. Probably just heard that little shoulder pop too. That one feels a little off. Anyways, yeah, shoulder specialist. So talked with him, and he basically, he's like, man, it barely looks like you have a grade 3 separation as far as like how it's presenting physically. Of course, the MRI and the X-rays confirmed all of that. But when anybody with this injury knows, you're the ones that notice it the most. So, I can always feel that little bump. And anyways, so he basically said though, he would still recommend the conservative approach, give it 3 to 6 months. And then if I'm not happy with it, he'll definitely operate on me if I want him to. The method he would do is they would, basically cut off the end of the collarbone. I think he said just like kind of shave the end of the collarbone off, drill 2 holes in it, and then you have a cadaver ligament he would loop through cadaver ligament to pull it back down onto the scapula, the acromion process of the scapula, and then reinforce that with like surgical tightrope wires, like Arthrex, I believe he called it. So that is an option. Initially, I decided, okay, I'm doing pretty good. I'm moving. I'm back at work. I don't want to have the surgery. But part of me also thinks like long term, I know it's just cosmetic, but I would like this to be pulled back down. And I just wonder what it's going to be like long term. Now, the conflicting part for me though is, hey, this is only 6-7 weeks out, right? And I'm back golfing, I'm back in the gym, I'm back at work. Like I kind of got my life back, which is one of the biggest things. But I also wonder about the other outcome. What will my shoulder be like repaired, right? But it would be very hard to have the surgery, and then he told me up to 6 months recovery period before he'd let me go back to work. So 6 weeks versus 6 months. I mean, that's the tough part, man. And at the end of the day, from everything I've read, this is basically just cosmetic, right? I don't like how much it shifts when I kind of reach across my body or if I lay on my side and it starts really popping out. But those are things I'll probably just have to deal with, man. So what I decided to do for now, this is considered elective surgery, so it's not like a vitally important surgery. I decided to jump on a wait list, right? Because it's for the hospital that I'd be having this done through, it would be a 3 to 4 month wait potentially before I could even have the surgery. So I decided, you know what? At the 3 or 4 month point, I'll be basically 5 or 6 months out from this injury, right? And I'll kind of know where I'm going to be at, I would say basically permanently. And if I'm not happy at that time, I could go through and have the surgery. Otherwise, it's kind of like, hey, I could always cancel it, right? But I kind of figure right now it'd be good to get on the wait list, and then I'd be 5 to 6 months out and just really see how I'm doing. I'm very happy with the progress I've been making on the shoulder. So happy and thankful to have my life back to normal for the most part. Yeah, does the bump bother me? It does. I mean, I'm not gonna lie, it does. But there could be worse things, and I don't even think it's when you see it on video compared to my right. This is my right here. That's my normal shoulder, and then of course this is the injured one. It's really not all that noticeable, but of course, if you've suffered this injury, you notice it every day, and we can see it more than other people. I have to point it out to most people for them to be able to notice. Anyways, but yeah, full range of motion, feeling pretty good. I got to go to work in about 30 minutes, so I got to get ready for that. But yeah, I saw some of your guys' comments, and this is my follow-up video on that. I don't know when the next time I'll post is. Maybe at like maybe I'll do like a 70-day mark, so 2.5 or 3 weeks from now. So that would be 10 weeks post-injury, or maybe 3 months post-injury. I'll do the next video for that, or for this. So anyways, let you guys know how you're doing, because I've seen some of you guys suffering the same thing, and dude, I empathize with you guys, man. This is a tough injury to go through. So it does get better every day though. I would recommend moving this darn thing, keep it moving. Like they told me to keep this thing in the sling for 3 to 4 weeks. I decided against that. No way, man. So first 2 or 3 days, I started doing what I could, right? Got this thing moving, wall crawls, everything I could do to get that range of motion back. And it did hurt. It didn't feel good, I will say, but I pushed it, and I got full go on things that I like doing. So that's the update for this, guys, and hope you're all doing well. It's a tough injury to deal with, but you guys will get better every day. All right. See you guys.